So, welcome back to the R.D.C. show. Richard,
Derek,
Dad,
Chris,
got our special guest back this week.
back again.
Back again. Round number 2. Everybody else is too scared to come out.
You know,
Any of our friends that watch this, if you want to be a guest, just let one of us know.
let us know.
Always willing to let anyone come on. Well, this week's first topic I'd like to discuss, been in the news a lot, is the healthcare screw up or debate or whatever you want to call it. My personal opinion on it, I think Obama screwed that pooch on that so bad it's not even funny. To me, as a simple, dumb, poor working person, what I think, no, this is what I'm saying.
Right. Well, you know, I mean,
But what I think they should have done, in my opinion, is it should have been Medicare for all, but you had to make a certain, you know what I mean? If you made under $50,000, you could sign up for it. If you made over $200,000, no, you can't sign up for the government program. But
Right.
and then at the same time that I get that, so that I'm not freeloading and not making all the Republicans angry because I'm redistributing their wealth. Ha ha hee hee. I've never seen any redistributed wealth come my way. I don't know. But anyway, what I would have done was charge somebody like me that makes under $50,000 a year extra $50 a month, and in doing that, I know that automatically take it out of my paycheck in taxes, extra $50 a month of taxes, and knowing that I'm going to these hospitals, they're not going to be the best, they're not going to be the greatest, but at least I would be able to go see a doctor when I needed to, instead of doing what the Republicans like to refer to, like Sean Hannity and Rush Limbaugh. We'll just go into the emergency room. Well, last time I was in the emergency room, they gave me an aspirin and told me that I had the flu, and it cost me $1,900, which ruins my credit, stops me from getting a good job, and everything else. So the healthcare system, the way it is, I think is a bunch of poo. And that's all I got to say about that. What you think about it, Big D?
I don't know, dude. That's pretty deep.
And broke it off to pretty deep, huh?
It fucks up your credit to a point, though, man. But then it's not necessarily going to keep you from getting a job.
Well, no, but it's just it can. It's never stopped me from getting a job. I never could have had a good job anyway. But
it hasn't stopped me yet, but
I'm saying it's a messed up system.
it is a messed up system. Yes, yes, it is.
Everybody needs health care, but not everybody can afford it. So
What system isn't messed up?
and they get a profitable system, and then they don't care about the people who really need it. Instead, you got people in Hollywood paying $10,000 to get their boobs done, or their cheeks redone, or their Botox injected in their nose.
Because they feel
When
right for that shit.
People that can't go to the fucking dentist for 12 years, or people that have broken bones and can't go to the hospital and get them taken care of properly, or cut themselves too deep and just carry around super glue. Because they know if they go to the fucking hospital, it's going to cost them like 2 years worth of pay and ruin their life.
That's got to be pretty far in between, though, man. I mean, come on now.
Ask Christopher. He's been a roofer. I'm sure he's seen some people.
Well, I mean,
yeah, there's been people that got hurt, and they were already at the tipping point anyway, so I wouldn't say it led them into financial ruin, but
Right.
it certainly didn't help. It was a straw that broke the camel's back.
No, it doesn't help.
Well, what do you
Especially
think
if you're
about the whole
out of work.
healthcare thing? How should it be in America? Should it be the way it is? Profitable?
I think the system that we have now is broken. It's for profit, and it's basically
And it's a
more
non-profit.
it's centered more around the treatment than it is the curing people.
Right.
So there's no money in curing people. If you can make somebody well again right away,
Have them come back.
why not just keep treating the symptoms
Right.
over and over again? But we get into a sticky. There's kind of a
That's deep,
sticky area,
yeah.
where we decide if we have a national health care system, because is it? I don't believe in death panels or anything like that. I think
Right.
that's just totally ridiculous.
Right.
But are they going to start legislating to us what we can and cannot eat? Are we going to have to hit a certain goal in weight?
I think it could come to that.
Well, Christopher, you already got companies that do that. There's already companies in America to insurance causes, or whatever you want to call it, insurance
Clauses?
clauses that if you smoke cigarettes, if you don't keep a certain weight loss, they can have you fired from your job or you get canned. They make you take tests now to see if you smoke cigarettes, and that they now can make you do a cholesterol test to see if your cholesterol's too high and risk of having a heart attack, and that way they won't give you the job.
I think what's more
So
scary
they already
is
do that.
you know they're talking about
point.
testing for DNA to see if that you're, you know, you have a bad disposition towards certain, you know, if you're already likely to get a cancer or have heart problems. You know, they kind of do that now with family history, whereas if you have if there's a lot of heart disease in your family, then you know, you're going to go through a lot more tests, you're going to deal with that, and you're also going to get billed a lot more. I mean,
Well, the system you have now basically bankrupts the country. You got people like me that go there that can't afford it. They get charged $1,900. Well, you don't think they don't get that $1,900 back? No, they get it from the people who are paying insurance to get taxed. And they just allow it to happen over and over and over again.
well, like you were saying, I twisted my ankle.
Stock market.
Yeah.
Fucking bullshit.
Stepping down off a ladder, I took a bad step and twisted my ankle, and that cost me $1,800. And I got a bill because I was uninsured.
Yeah.
I got a bill from the receptionist. I got a bill from the janitor. I got a bill for the room.
Yeah.
I got a bill from the doctors and from the nurses and for the supplies that I used. I mean, it was just a ridiculous amount of people who were charging me money.
Like
and I thought to myself,
a Q-tip?
I mean, really, the room was dirty when I went in there. I'd never seen a doctor, ever. Nobody touched me other than a wrap of ace bandage around my ankle. But they wrote down my vitals, like my respiration, heart rate, and all that. They never touched me.
Look, when I first had Legionnaires, right, before my doctor took my blood and checked to see what I had and couldn't figure out I'd been sick for so many weeks and it wasn't going away, I went to Sparrow with no insurance. That doctor got no closer to me than you are, and he goes, "You got bronchitis," and gave me bronchitis medicine.
No.
I found out 2 weeks later that medicine was doing me absolutely no good because I had something totally different than bronchitis. And that medicine was totally uncalled for, but he just diagnosed me without ever looking at me, without running any tests, because I had no insurance. He just wanted to get me in, get me out, and charge me $2,000.
Well, see, a lot of people that have insurance, so they don't see that. They just know they pay their insurance, and their insurance pays the bills.
We
so
have
they don't
the
see the 7 or
insurance.
8 different people who are hitting them for a charge for the same damn thing. Look, they just don't see it. But that's what their insurance is paying for. That's why their insurance is so
Some
high.
of the things that Obama did in
They're
healthcare were good, like allowing kids to stay on their parents' insurance until they're 26 and out of college.
Right.
Or
As long as
pre-existing
they're still in
conditions being gone.
Yep.
How many people have died over the years because they had a pre-existing condition?
Mm-hmm.
Oh, you have cancer. Well, you know what? You had that free.
We can't do nothing for you.
You got to go away.
See, that was
pre-existing